Thanks for joining us today. I'm Shannon, Sales and Marketing Director with RumbleTough, and I have the privilege of talking today with Judy Bannon and Bridget Gaussa from Cribs for Kids. Welcome, ladies. So excited to get to know you. Judy serves as the founder and chief executive officer of Cribs for Kids, a national organization dedicated to reducing infant sleep-related deaths through education, prevention, and product innovation. A pioneer in infant health and safety for more than 3 decades, Judy founded Cribs for Kids in 1998 after identifying the link between unsafe sleep environments and sudden infant deaths, while serving on the Allegheny County Child Death Review Team. Under her leadership, the organization has grown to partner with over 2,000 organizations nationwide, placing more than 1 million babies into safe sleep environments and educating millions of families. Through her advocacy, Judy has helped shape safe sleep legislation, advanced hospital-based education programs, and launched a line of infant safety products, including the Cribette, that funds critical research and outreach. Her vision continues to guide Cribs for Kids as it works to ensure every baby has a safe place to sleep. And also introducing Bridget. Bridget serves as the Chief Operating Officer of Cribs for Kids and its subsidiary, Etc., where she leads efforts to advance safe sleep education and provides families with access to life-saving infant sleep products. Since joining Cribs for Kids in 2016 as Director of Program Development, she has played a key role in expanding the organization's reach, most notably by launching Etc., the public-facing online store that supports Cribs for Kids' mission through every purchase. Passionate about empowering parents and caregivers, she works to ensure that every baby has the safest possible start in life by promoting practices and products that align with the American Academy of Pediatrics recommendations, including breastfeeding as a proven way to reduce the risk of SIDS and other sleep-related deaths. So welcome to the both of you. Excited to get to know each of you and talk through some of these wonderful bullet points that we have here to help families when it comes to safe sleep. So Judy, we'll get started with you. Is there anything that you want to share with us right off the start?
No, well, I just wanted to say how excited we are about our partnership with RumbleTough and breastfeeding organizations in general, because breastfeeding, as you mentioned, is a deterrent to SIDS. Mothers who breastfeed are less likely to lose babies to sudden infant death syndrome or to SUID. So we have always worked to forge partnerships with groups just like yours.
Yeah, that's great. And thank you for pointing out the SUID term. Me personally, actually, I had not heard that term used as often as I have SIDS. So in case there's people watching who aren't familiar with the term SUID, would you mind explaining what that stands for?
Sure. SUID is sudden unexplained infant death. And it is an umbrella by which all kinds of infant deaths are under. The SIDS is just one of the deaths that is referred to as a SUID death. Basically, it's saying that these deaths are undetermined, and we really don't know exactly why the baby died. So rather than just calling them SUID deaths, because many of them are suffocation or due to babies sleeping in unsafe sleeping environments, the term SUID is the preferred term right now.
Oh, understood. Well, thanks for sharing that with us. Learn something new all the time. It's great to know. So Cribs for Kids began as a grassroots effort in Pittsburgh. Can you share how that small start grew into a national network with over 2,000 partners?
Sure. Back in 1987, I became the executive director of SIDS of Pennsylvania. And at that time, we had no risk factors. We had, as to what was causing SIDS, we were really a support group, a bereavement group for families whose babies died. My goal at that time when I took the job was to find out why the babies were dying and to do something to prevent these deaths. So by 1992, the SIDS organization in Australia started the sleep campaign and started putting babies on their backs to sleep rather than their tummies. They were joined by the United Kingdom and New Zealand. And what they found was a reduction of 50% of the deaths because babies were simply being put on their backs to sleep. So I happened to be at a conference in Sydney at the time when all of these results were coming out. I came back to Pittsburgh and I said, we have got to start teaching safe sleep or back to sleep to our parents in the Pittsburgh area. So we started to do that. And by 1992, we started to see a reduction in those deaths. By 1996, we had reduced our rates by about 50%, but babies continued to die. So I did a study with our coroner, Dr. Cyril Wecht, and discovered that the babies that continued to die of what at the time was being called SIDS were found in unsafe sleeping environments. Many of them were in bed with parents. A lot of them were in their crib, still on their tummies, with stuffed animals, bumper pads, things that they could breathe into and basically suffocate into. So at that point, we decided to start putting these low-income infants into cribs, and we started a program just in Allegheny County, and we called it Cribs for Kids. In that first couple years, we gave 500 cribs out to families, and we saw a drastic reduction in the number of babies dying. In addition to the cribs, though, we were doing a lot of public service announcements on TV. We were working with hospitals. We were approaching anyone we could who were in touch with parents to tell them that babies should sleep alone on their backs in a crib. If they didn't have a crib, they could come to us. We would give them a crib. So by 1998, those figures had dropped so severely that we decided to make this into a really big campaign, and we started doing it in the counties surrounding Allegheny County, the 10 counties. We started approaching hospitals and first responders, and by 2004, those rates had dropped. We had gone from losing 28 babies a year to SIDS, and that in 2004, we only lost 4 babies. So that was such a drastic reduction, and people from all over the country started to approach us and say, what are you doing in Pittsburgh? It's making such a difference. And we told them about our Cribs for Kids campaign. Little by little, we started to have them join us in our efforts. We had them sign a trademark license agreement saying that not only would they supply cribs to their clients, but also the main thing was the education about safe sleep. And little by little, the first year we had 7 partners, and it just continued to grow. And now we have really close to 2,500 partners nationwide who are doing our program. So it was really a grassroots effort here in Allegheny County that grew into something really special, and we're saving a lot of babies' lives. At the beginning of this, we were losing about 10,000 babies a year to SIDS in the country. And our figures now, even though we look at them and we say they're still bad, and they are bad, we're down to 3,700 babies dying a year. So our goal is to eliminate those just by making people aware, and if they can't afford a crib, making sure they have a way to get a free one.
Wow, what an incredible story. I've had chills.
Yeah.
What a great, that's exactly what, when someone has a goal and a passion in mind, whatever that might be, that's exactly what you dream of, right? Just a little seed gets planted,
Yes.
a passion that you have about helping somebody, saving people, changing lives. And that's exactly what it's about, exactly what you just shared. So, wow, that's just totally incredible. So kudos to you, and kudos to your organization. So that's incredible. What were the early challenges that you had in convincing hospitals and community organizations to prioritize safe sleep education? And how did Cribs for Kids help shift that culture?
Well, the main thing was we were a small nonprofit who discovered this, and we were going to like Allegheny County Health Department McGee Women's Hospital, which at the time had about 10,000 births a year. And we were telling them what our findings were through the coroner's research that we had done. And it was hard. We had no credibility. You know, we were trying to convince them that this was the way to go. And they were so research and scientifically oriented that they wanted to see data and they wanted to see years of study. And I kept saying to them, how do you study this? Do you put half the babies on their tummies in an unsafe sleeping environment and half on their backs and see how many of those babies die? I mean, there was no way that we could really study it without just starting the program, putting babies in cribs, and doing really great education to the parents. So that was probably one of the hardest parts. The other was funding to buy the cribs. Again, we had to convince, we have a wonderful philanthropic community here in Pittsburgh, but it was a matter of me going to them and convincing them that this was, their money would be invested in a program that could really save babies' lives. So those first years, sometimes I look back and think, how did we ever get through that? But through the hand of God, we did it. And people gave us funding. And with the funding came credibility to the hospitals. I went into McGee and I said, I want to start giving you cribs to give out to families. If you do the education, you would give them a crib through us. They really weren't excited about that. So my next step was to get a bill passed in Pennsylvania that made it mandatory that every mother, before she left the hospital, was educated about safe sleep. So once I got that bill passed, I went back to the hospitals and I said, it's now a law that you have to educate these parents. So in educating them, one of the questions we'd like you to ask is, do you have a safe place for your baby to sleep? If they don't, then we will supply you with cribs to give out. So then they were willing to do it because of the credibility we got from the passage of the bill. So it's just a matter of wearing all different hats and figuring out what you have to do to make things work. When you have the passion, it's easy.
Agreed. Yep. You got it right there when you said you had to pass a law, right?
Yes.
Can't
Yes.
ignore the law.
Right, for sure.
That's good. Cribs for Kids is often credited with helping define how hospitals approach infant safe sleep. How did the hospital certification program come to life and what impact has it had? It sounds kind of like that's what you just explained with the passing of the law and kind of funneling through and making sure that there was a starting point, and then the hospital felt good about the fact that the question got implemented about, do you have a safe place for baby to sleep? Yes or no. If they didn't, they got handed off to you almost as like a referral so that the parents weren't just kind of left on their own devices, that there was a full program kind of built in to care for them even after they got discharged from the hospital.
Yes.
Which, as you said, made it seem like the hospital would not be kind of left alone to their own devices and the parents would be cared for.
Right. Yes. So we figured the best way for the hospitals to get involved, they had the law, so they had to do the education. We wanted to reward them for doing the education and for giving out our cribs. So we developed our hospital certification program. It also went more in depth with the education than that bill that we had passed. The bill was passed in 2010. In 2016, new guidelines came out from the AAP. So as we developed our hospital certification program, those new guidelines were also built in to the hospital's education. So that was a way for us to reward them by certifying them as a safe sleep hospital, but also keeping their education up to date.
I love that. That's very similar to how we do things in the breastfeeding community with the baby friendly initiative that came out. And so they have certain guidelines they have to adhere to be considered a baby friendly hospital. And so, yeah, that's very interesting that there's very much an overlap between safe sleep and breastfeeding. So love it. Love to hear about it. Okay, what inspired the creation of the National Public Safety Initiative, and how did Cribs for Kids begin engaging first responders as partners in promoting safe sleep education? Great question.
Yes, well, our public safety initiative is one of our crown jewels. Bridget, back when she was doing programs, because of course, at the beginning, we had very few people. In fact, I wrote a book called Five Ladies in a Forklift, and it's how I began Cribs for Kids, because there were 5 women, and we had a forklift out in the warehouse that we schlepped our cribs around and shipped them out of our warehouse. And so we knew that we needed help from the community to spread the word about safe sleep. And we thought about who is in people's homes that they would invite into their home, and they were the public safety people, the firemen, and the EMTs and paramedics. So we did a program where we educate these groups so that they know everything about safe sleep. That way, when they go into a home, let's say grandma had a heart attack, they go into that home and they see a baby, they engage the mother with where does your baby sleep? If the baby doesn't have a crib, or the baby's in bed with the mother and the crib's full of diapers and dirty clothes, they talk to the mother about the importance of safe sleep. These are people who, in the past, their only connection with parents who had infants was when they were called to a home when an infant died. And it's one of the worst calls that EMTs and paramedics and firemen have to make. So they're more than happy to be educated about safe sleep, because it could prevent one of these deaths. And it's really a rewarding program. And we just keep adding on more and more groups of EMTs and paramedics and firemen throughout the country.
That's awesome. What a wonderful blessing that is. The National Safe Sleep Conference brings together experts from around the country. What inspired you to create it? And how do you see it shaping the future of safe sleep education?
Well, we did it because we wanted to share the education that we had. We kept getting phone calls from our partners as they were signing up, and they'd say, I have an idea. This is what we're doing in our community. And I thought, wouldn't it be great if we could all gather together and people would bring their ideas and talk about what they're doing in their community that works? Because an idea is an idea, but until you prove it and it works someplace, it can't be duplicated. So we had our first conference in 2008, and it was wonderful. We had about 350 people there. They were all new partners, and they were so enthusiastic. And that's really where we began our hospital certification program. That's where the bones of it came, because we had several nurses from hospitals talking about how they do the education, how they do audits on their newborn nursery to make sure those babies are placed on their back. They all had different ideas. And Dr. Michael Goodstein, who's on the SIDS task force, but also our board member, happened to be at that conference. And he came to me and he said, his hospital was very active with safe sleep. He's at York WellSpan. And so he said, we have to turn this into a program so that we can share all of these pearls of wisdom with all of our partners. And we began the hospital certification program. But it's just a great way to just get people together to share ideas, but to also meet each other. We do a monthly newsletter. We highlight all of their accomplishments. So when they get to our conferences, it's like they already know each other, because all of the newsletters that we put out and how we talk about what everyone's doing throughout the country.
So. I love that. If they're professionals watching, is there a way for them to get in contact with you, or do you have a certain portion of your website if they want more information about joining that?
Oh, sure. They can go to cribsforkids.org, and there's a drop down of conferences. Our next conference will be next October, and we're talking about, after COVID, we were doing just virtual conferences. And this year, it looks like it's probably going to be a hybrid. So we'll be getting together in person again. So it'll be really exciting.
Good, good. Well, that's exciting. Hopefully we'll get some people to hop on over there and check it out. That sounds like a lot of fun. Good. Education has always been central to Cribs for Kids' mission. How has your approach evolved with the addition of online tools like the Professional Training Series and Safe Sleep Academy?
The online part of what we do is so huge. When I think back to how we used to, when we were signing up a partner, we would send them a literal 4-inch binder of education and information. And then CDs came out, and we put everything on CDs, but it was still so labor intensive, and we would have to mail everything out. And then once online education became a thing, we were fortunate to have a young woman who actually has her master's in social work, but loves putting websites together and education. And she's not doing much social work, but she has just done wonders as far as putting all of our trainings online. The thing about Cribs for Kids, we have always, our main goal is education. We provide the crib if necessary, but we want to educate the whole country. If you can afford a crib, you can come to our site and still get all of the safe sleep education that you need. But we're very excited about being able to have a department that deals just in programs. And our program department started out as our hospital certification program or department, and it has now morphed into educating all kinds of professionals with up-to-date training that include pre and post tests. It's just wonderful. Again, anyone who's interested in taking any of our trainings, all of our education is free. So people can get online. Our Safe Sleep Ambassador program, which we started back in about 2015, now has 90,000 people who have signed up and become Safe Sleep Ambassadors. That program is also free online. So if you were doing a class where you wanted to educate a group of people about safe sleep, they could get online and take our Safe Sleep Ambassador training, receive a certificate, and become a Safe Sleep Ambassador. So there are so many trainings online that people can take advantage of: EMTs, paramedics, a hospital certification. But the main one, and all of them start out with our Safe Sleep Ambassador. Once you become a Safe Sleep Ambassador, you can take the other trainings, and it's all free of charge.
Nice. That's great. Now, do you also have, I presume you also have classes for parents that are also online, or is it just
Yes.
for parents? Okay.
Yes, we have a Safe Sleep Academy where the parents can go and learn everything about safe sleep. They can also take the Safe Sleep Ambassador training. It's not just for professionals.
Okay, great.
Yeah.
Good. You guys have a well-rounded circle there, and not leaving anybody out, right? That's
right. Exactly.
Love to see that. Okay, so let's see. Cribs for Kids has been instrumental in advocating for important legislation, like we talked about before, including the Safe Sleep for Babies Act. What role did the organization play in supporting or influencing this kind of policy change?
Well, we were one of the leaders in getting this bill passed. John Cahan from the Aaron Matthews SIDS Research Institute out in Seattle, and who worked for Microsoft at the time, was really the brains behind getting it up and running. But he came to us for our support because we had so many partners throughout the country who could write letters to the legislators. We hosted a day on the Hill for everybody to come in and meet. We had breakfast for them, and then we went off and we talked to all of our legislators about the importance of getting this bill passed. And it was amazing. We were fortunate enough to get it passed. It was December 31st, I think, 2020. It was like the last day of the administration and that General Assembly, but we did get it passed, and we're really proud of that.
Wow, that's incredible. Do you have it on the wall somewhere, like in your office?
Yes,
Yeah,
yes, we do.
I would imagine so. That's awesome. Fantastic. Community partnerships have always been part of your vision. Can you talk about how collaborations with healthcare systems, child welfare agencies, and public safety groups strengthen your mission?
There again, they are our eyes and ears in the community. They're the ones that are out there actually dealing with the parents who need the help. We recently did a research project with children, Pittsburgh's Children's Hospital, where their child advocacy group for child abuse did a training along with us, a webinar directed directly to the child welfare DHS people in our community and throughout the state. It was so well received. It has already been given. We have 67 counties in Pennsylvania. It's been given to 60 of the counties. And it's training that teaches the child welfare workers, the CYF workers, how to approach the mothers, how to talk to them about safe sleep without being accusatory, how to make sure that that baby that is in their care is put down to sleep for every sleep in a safe place. So none of that would have been possible without our partnerships with the health departments and DHS, and again, the hospitals who are stepping up and doing our education. One of our groups that we do education in Pittsburgh and Allegheny County with is Healthy Start. So we work with them directly. They're out in the community. They have health fairs. They talk to their mothers all the time. And we supply them with all of the cribs and sleep sacks and anything they need to perform their duties in educating parents about safe sleep. So it takes a village. You know, you just can't say, I'm going to do this. We can do it. We're on our own. You have to work with all members of your community to make sure. And it's important that that mother hears this message from different groups, because if she's just hearing it from the hospital or the pediatrician, but her caseworker isn't mentioning anything to her, or she's not seeing an ad on TV about it, or she sees on TV an ad where a baby is sleeping with bumper pads and a stuffed animal, then there's so many mixed signals. So we have to make sure that everyone is on the same page as far as education goes. And that's our role as a national organization to make sure that's happening.
Yeah, I'm glad you brought up that point about other brands and products, that we all have a duty to make sure that the advertising that we are putting out there honors exactly your mission, that,
Right.
you know, if you're showing a baby in a crib, that you're showing that baby in a proper sleep position, right?
Exactly.
I'm glad that you brought that up, because that's a very important element that every brand out there, you know, has that duty to do. So thank you for bringing that up. That's a very good observation. So I appreciate that. Final question for you. Looking at where Cribs for Kids stands today with education, products, conferences, and advocacy, what achievement do you feel best represents the mission you started with?
I think the fact that we were able to develop our own crib, our cribette. Our model at Cribs for Kids is really a business model. My background is business. So that was another reason it was hard for me to sell this idea to people in the healthcare professions and health departments, because I didn't come from that background. But when we got to the point that we were supplying so many cribs throughout the Western Pennsylvania area, and we were doing constant fundraising. In fact, Bridget at the time was one of our key volunteers. She had a real day job, and then at night she would come to the mall and wrap Christmas presents for us, and she would sell entertainment books and all of these labor-intensive things that we did. And then it occurred to me we were telling our partners to go to Toys R Us and buy the Graco Pack and Play, and I would call the Toys R Us in their area and ask them to discount the price of the Pack and Play so that they could buy more for the little bit of money they had. It occurred to me that if we developed our own products, I could sell those products to our partners at really discounted pricing, and the little bit of profit that came off of those products would keep our doors open. So that's what we did. And we started out with the Graco Pack and Play, and then we developed our own play yard, which we call the Cribette. And it has the Safe Sleep message embossed on the whole, on the fabric. So the Cribette says ABC, alone on my back in the crib. It has little blocks on it, so it's playful. Our new design has our Babette whale, which is adorable. So the mothers are really going crazy over that. It's in beautiful colors, pink and blue and teal and light gray. So it's really a successful product. As we sell that product and our sleep sacks that also have the Safe Sleep messaging on, the money that we make then comes back to keep our doors open and pay our staff, but more importantly, to develop programs and education that are free to all of our partners. So our partners know that when they buy our discounted products, they're not only getting a product at the best price around, but they are also contributing money to the education that we're able to put out throughout the country. So our Cribette is, and our products are really the mainstay of what we do. And that gives us the opportunity then to supply all the education. We call our education and our trainings the icing on the cake, because it makes everything so sweet. And our partners then, there's no charge to become a Cribs for Kids partner. There's no charge for the education that we put out. There's no charge for hospital certification because of the sale of our products. So we took the profits. A corporation would take those profits and make their bottom line look good. We take those profits, and as a nonprofit, we put them back into the education. So we're really proud of what we've done.
I love that. Now, is there any other place besides cribsforkids.org that anyone can go and buy these items, or is it just on your website?
Yes, there's another place called Etc. All of our products end in ETTE. We have the Cribette, the Swaddlette, which is a little swaddle for babies. The Snoozette is our sleep sack. The Snackette is our little chair that the baby can sit in at the table. And it just goes on and on and on. Bridget can talk to you more about that. She's in charge of our Etc. For-profit store. So Etc. is public facing, so anyone can order from there. Our store for our partners is there are no taxes involved or anything, so they can come to our store as a nonprofit and buy through our Cribs for Kids store. But if one of their clients then wants to buy other products, they would go to Etc.
Got it. Okay, great. Well, thank you so much, Judy, for sharing with us today. It was great to meet you and great to talk to you.
Nice to meet you too.
Yes,
Thank you so much.
Sure. Okay, so now I'm going to talk to Bridget, COO of Cribs for Kids and Etc. Can't wait to hear more about Etc. So first question for you, Bridget, as COO, you've helped expand Cribs for Kids reach through both programs and product innovation. How do you ensure that every product reinforces safe sleep education?
Great question. At Cribs for Kids, every product that we design or distribute really serves a dual purpose. We want it to meet a practical need, and then we also want it to reinforce that safe sleep messaging. So every product is both functional and educational. So everything from our packaging to like the instructional inserts, we're building the education into every step of our customer and then the partner experience. Whether it's the Cribette or the Snoozette, like Judy mentioned, the wearable blanket, or even just our fitted sheet. Even our fitted sheet has the safe sleep messaging on it. So it's really just everything is reflecting the ABCs of safe sleep. So it's that messaging, and we're making it consistent, right? That alone, on the back, in a crib. And that really helps too the parents, with that messaging being on each product. And it's helping the parents, put that practice into, and they're practicing that confidently though too, right? Because they're seeing that ABC. And so it's also that constant reminder for the parent or caregiver how to safely sleep that baby.
Yeah, I love that constant repeated messaging
Yes.
over and over again. Yeah, there's like the scientific research that shows when you hear something over and over again, like it just sticks with you. So that's great. Okay. The cribette is recognized nationwide as a symbol of safe sleep. What goes into maintaining its safety standards and making it accessible to families who need it most?
The cribette, it's much more than a portable crib, right? It's a symbol of safety and consistency. So it's across our partner network. That's how they recognize it, right? And so we really work closely with the manufacturers and the factory to ensure that it meets or it exceeds compliance with all of the federal safety standards, CPSC, ASTM, and we're continuously evaluating the design improvements based on feedback from our partners, the hospitals, the health departments, and families, the people that are receiving our product too. We love to get the feedback from anyone that's used our products. So just constantly keeping up with, the standards and making sure that, like I said, we're meeting or exceeding those standards. And then our distribution model, that really prioritizes accessibility. So with our partners being, throughout the country, we work with hospitals, managed care organizations, and community partners, just so that no family goes without a safe sleep space. And that's regardless of income or location. We even have programs in which we will ship directly to the family's home. We just want to make sure that anyone that needs that safe sleep space will receive it.
Love that. Now, about those programs, is there a way for parents, if they're watching this, to go onto your website and apply for a specific program, or where do they go for more information about that?
So not necessarily to apply for the program, but they can definitely go to our partner map if they are in need and they are just interested in learning more. They should go to our website and go to the partner tab and then find a partner. And all they need to do is type in their zip code, and it'll just take them to the partners closest to them.
Oh, wow. What a nice tool to have. That's great.
Yes.
Okay, the next question is, the launch of Etc. has been an exciting extension of Cribs for Kids. What inspired that idea of creating a retail brand that gives back 100% of profits to support safe sleep initiatives?
Oh, well, Etc. was born back in 2020. What a better time to start a business. But it was born really from a desire to really extend our mission into the marketplace in a way that really would empower consumers to give back just effortlessly, right? They just needed to go shopping for their baby. So we saw that as an opportunity to really blend like the beautiful functional baby products with a greater purpose. And with every purchase, it directly supports the safe sleep programs through Cribs for Kids. So it was just like the idea was to create a retail brand that not only celebrated parenthood, but it also would build awareness and, and of course, then provide funding for our free educational programs and cribs to families in need.
Love that. Love when you can build something that just impacts in multiple ways.
Right.
And just like you're talking about with the nonprofit, and then taking the small little bit of profit that you get from selling those goods and putting it back into the bigger mission and just keeping things going, because it is hard as a nonprofit, especially to find those grants and those dollars and everybody, it's so difficult. So yeah, leveraging those baby goods and those items that parents need anyway, and just getting that back into the nonprofit and furthering the mission is just like genius. So you guys are just doing so amazing.
Oh, we love it. We absolutely love what we do. Thank you.
Yeah. It's so great. How do you decide which new products to add to the Etc. line, and how do you balance everyday baby essentials with the organization's education first mission? That's a great question.
Oh gosh. Yeah. So we carefully curate the Etc. line. We're looking to balance like both practicality and purpose. So each product is designed to really complement those safe sleep principles. So, nothing that contradicts or complicates those practices will make it into our catalog. So we really focus on like the essentials that families use every day, like the sleepwear or the swaddles, nursery accessories. And then we also just want to ensure that any of our offerings really reflect the quality and the education first philosophy. And that is really like at the heart of Cribs for Kids, right? It's all about the education, like Judy had mentioned too. So we bring on products that they are high quality and as multifunctional as possible. And then we really just want the parents and the babies that are receiving those gifts to really just like feel the love behind the gifts that they're receiving.
I love that. Yeah, with the love that's in your mission and the purpose, and then the love that's in the products. Like, yeah, this is so great. I love it. And the passion that you guys have and the love that you guys have to be able to do what you do. I mean, it's just a different thing when you work in nonprofit and because I've worked in nonprofit myself too. So when you have that love and you have that passion, that's what you wake up every morning, to do and to serve people and to change lives and to save lives, right? So you wake up every morning and yeah, I mean, it's incredible. So you guys are doing just an incredible job. I know I keep saying that over and over again during this interview, but it's just the impact that you guys have made over these years. I mean, I'm learning so much just from talking to you all. So this is incredible. So good. And just to see that you have everything for first responders and parents and just all these people that are, hands-on with families. There's just so many messages that, I mean, parents are getting hit with all kinds of information. Some of it's contradictory. I mean, we encounter that all the time as lactation providers. We just try to tackle all these different things and try to, help them battle through the noise. And so it's just so great to see that you guys have such wonderful programs in place and that you're trying to get this out to as many people as possible so that there's just that one clearly defined ABC message. We saw the same thing with baby wearing years ago with the ABC and, just keeping it very simple so parents really understand, how to keep baby safe. So I love to see that.
Right. And I think it's so important, yeah, like you said, just to keep it simple, right? We can't give parents, a list of like 1,000 rules to follow. So let's keep it simple and consistent messaging.
Yeah.
So important.
Yeah. Cribs for Kids continues to grow its professional training series for those working directly with families. How does this educational outreach intersect with your product development and community programs?
Oh, so our professional training series, we're really trying to bridge, the education and action. And so by training different professionals like nurses and social workers, our home visitors, and just community advocates, we're really ensuring that guidance that the families are receiving is consistent and that evidence-based, right? That's so important that it be evidence-based. And like the knowledge that's shared through our training informs our product, it informs our product development and vice versa, really. Like for example, like feedback from professionals in the field, that often helps us to refine our kit contents and our educational materials, just so it's better for the families then in the real world needs. And those are the professionals that they're out there every day talking to these families. So, who better else to hear from? And in fact, we just had a case of this happen like literally yesterday, where one of our partners had made a suggestion to Devin George when she was at a conference over the weekend. And the partner had made a suggestion just about adding a QR code onto one of our partners or onto one of our products. And, and that QR code taking them directly to our Safe Sleep Academy and the education. And I mean, we love the idea. So, I mean, of course, we're going to move forward with it, but it's all about just really the collaboration and working together.
Yeah, great. It's amazing what can happen when you work together, right? Everyone has wonderful ideas. And yeah, I love that. Love it. The organization's partnerships with managed care organizations is unique. How does your team collaborate with these groups to deliver both education and tangible resources to families? I'm very curious about this question myself, coming from working in lactation, working with Rumble Tough, working with insurance companies on the durable medical equipment supplier side. So when I heard you guys mention that you work with managed care organizations, I said, wow, that is very interesting that from a nonprofit perspective that you all work with MCOs. So yes, please tell us more.
We do, yeah. In fact, our work with the managed care organizations, it's really like a cornerstone of our outreach strategy and the work that we do. The partnerships that we have with the MCOs, they really combine that health education with a tangible support. When families receive a cribette or a safe sleep survival kit, they're also receiving, counseling on the safe sleep practices from a trusted healthcare professional. And so together, we're aligned on goals. And then of course we are able to get data tracking and then our distribution logistics to ensure that the resources are reaching the families who need them the most. And that's just improving it's not improving just the safety outcomes, it's also improving health equity as well. So we love this program. It is just phenomenal.
That's amazing. Because yeah, exactly. And you're again kind of back to you're meeting people right where they are, but you're also meeting people in so many different ways. And again, trying to reach them through so many different facets, right? So again, what we were talking about earlier with Judy, it used to be maybe the only time they would hear about safe sleep practices is when a mom, may have had an unfortunate interaction with, CPS or something. But now if, somebody in the home had a tumble and EMS comes in and sees baby in the crib, well, then EMS has been educated. And then the MCOs that you're working with. So when mom calls in and asks a question about getting a breast pump through insurance or something, maybe she's met with, by the way, did you know that we also have this resource about putting your baby on their back to sleep? And there's just so many different ways that these parents are now getting hit with this information. So I think that's really, really important. So that's great. Many families first encounter cribs for kids through a hospital or community giveaway program. How do you ensure that each kit or product sent out serves as both a tool and a teaching opportunity?
Oh, okay. So every Cribs for Kids kit, everything that we design here, it's designed to teach as much as it provides, right? So each item, whether it's just the sleep sack or snoozette or the crib sheet, or even just like an educational booklet, any of our brochures that we have, it just reinforces those safe sleep habits. So we really work closely with our partners to ensure that when the products are distributed, that the families are receiving one-to-one education that turns that kit into this like really lasting learning experience. And that's not just a giveaway. So really working with them, really getting that consistent messaging. And like you were talking about, we're really trying to change the culture around safe sleep. And you can't do that with just a one-off. So it's just always making sure that education is provided. And those one-on-one conversations are so helpful in getting the consistent messaging.
Yeah, agreed. Etc. brings the mission of safe sleep into the marketplace in a fresh way. What response have you seen from consumers, and how does that support Cribs for Kids' broader vision?
Oh my gosh, the response to Etc. has just been overwhelmingly positive. Parents really appreciate that their purchases have a purpose, right? And that they can directly support a mission that they care about. And so we've really seen strong engagement at events like at Babies and Bumps, where customers not only shop, but they're also connecting, with our safe sleep education in person. This makes such a huge difference, and they love it. The connection between the commerce and cause helps really sustain Cribs for Kids, our broader vision to make safe sleep second nature for every family.
The Cribs for Kids National Conference brings professionals together from across the country. How has that event helped elevate the organization's product and education efforts?
Well, the Cribs for Kids National Conference has really become the heartbeat of our professional community, right? It's where innovation and that education and collaboration, like Judy was talking about too, that they all intersect. And just by bringing together experts from across the country, the conference just like amplifies the best practices. It really inspires product advancements, and it really strengthens our collective ability to reduce those sleep-related infant deaths. So it's also just a key platform for sharing new research and like showcasing the products and just reinforcing that unified and consistent messaging.
As the organization continues to expand its reach through education, e-commerce, and partnerships, what do you see as the next major step in strengthening Cribs for Kids' impact?
Well, as we continue to grow through our education, our e-commerce, and partnerships. I think our next major step is just deepening integration and like really connecting every program, our products, and our partner under just one like cohesive, framework of safe sleep support. So I think it'll really include expanding our digital education tools, enhancing our outreach, and just developing new product innovations, like really just to meet the families where they are. I think ultimately our goal is just to really make safe sleep education as accessible and actionable as possible. And like our products, it represented changing the culture of safe sleep, just making safe sleep a cultural norm. I think that's it, making safe sleep a cultural norm.
I love that. You could not have said that any more perfect. Well, Bridget, thank you so much for joining us today. Is there anything else that you want to share with anyone that might be watching?
Just if they have any questions about safe sleep ever, don't hesitate to reach out because we are more than happy to help.
Awesome. Love it. Okay, so cribsforkids.org is where they can go to find you all. Thank you both so much for joining us today, and we look forward to all of our future partnerships together.
Oh, thank you, Shannon. We're so excited to be partnering with Rumble Tough. Thank you.
Thank you.